You might have seen some conditions where when you use pulse oximeter in the limbs, peripheral limbs, it shows the low reading, but patient may not have such respiratory symptoms or not such respiratory distress, so it may be falsely low saturation. So what are the conditions where you get falsely low spo2 from the peripheral limbs? In patients with connective tissue disease, with Raynaud phenomenon, in where there is vasoconstriction in the peripheral limbs, what happens? That saturation is detected low. Or if patient has skin hyperpigmentation, or due to motion artifact, if patient is having seizure, in that condition also, and with nail polish, obviously. Okay, so these are some conditions where you get falsely low saturation. So how can you know whether the saturation is falsely low or it is truly low? So in the pulse oximeter, what you see in the bottom, you are seeing the waveform, that is called plethysmography. So you must see dicrotic notch. If there is no dicrotic notch, you can suspect that it is false reading. Okay, so if you are getting false reading from the peripheral limbs, so what you can do? You can use the pulse oximeter on the earlobe. Okay, so that is one option. And another is there comes a different probe that measures spo2 from forehead, and that works on the principle of reflectance technology.